So my top 5 tips for helping to prevent pelvic floor dysfunction are quite easy and simple for you to be able to do at home. Exercise. Keeping yourself fit and active makes a huge difference to your overall general health and function, but also to how your pelvic floor is working. Diet. So we all should really try and make sure that we have a nice balanced plate. If you're struggling with a bit of constipation, you find that you're straining to go to the toilet, trying to up your fibre but also up your water intake can make a really big difference. We know that if we're constipated and we strain a lot on the toilet, over time this can lead to pelvic floor weakness and other problems. So have a look now at what you're eating and just think about how you might be able to improve that. Pelvic floor exercises. So this is relevant for anybody that is experiencing a bit of leakage or things are feeling a bit weaker, whether that's the bladder or the bowel, to start doing regular pelvic floor exercises. They're simple to do. You just need to think about tightening your back passage as if you're trying to keep hold of wind, and imagine it lifting up and forward in a scooping or swinging movement as if you're also trying to keep hold of a wee. Trying to hold that for up to 10 seconds. Relax fully for 5 seconds and repeat that 10 times, 3 times a day is all that you need to do to start to strengthen your pelvic floor. It will take really around 12 weeks if you're doing that 3 times a day for you to start to see really big differences, but keep going with it because it can be very effective. Stress. So the last year has been difficult and very stressful for the majority of us. But prolonged levels of low-grade stress can actually be one of the biggest causing factors of things like irritable bowel syndrome, but it can also trigger pelvic floor dysfunction with our bladder becoming overactive or our bowel starting to change. So just taking a little look at your lifestyle and see what might be triggering things for you, and then look at ways that you might be able to help manage that better. And lastly, it's about speaking out. So if you're having any change in your bladder or bowel function, or you're experiencing pain around the pelvis, none of those things are normal. They can be very common, but speak to your healthcare professional, whether that's your GP or self-referring to see a physiotherapist or consultant, and they'll be then able to help you and investigate things further.